Happy International Volunteer Day.
Volunteers are more important now than ever.
But volunteer action is not enough.
Together, we can through volunteering.
Thank you, volunteers, for your response to the COVID-19 crisis.
Throughout key moments in the 75-year history of the United Nations, volunteers have been the driving force for change.
This year, we are highlighting the important contributions of volunteers to the response to COVID-19. Around the world, volunteers have been assisting vulnerable groups, correcting misinformation, educating children, providing essential services to the elderly, and supporting frontline health workers. As we gradually recover from the pandemic, volunteers will have a key role to play in accelerating the transition to green, inclusive, and just economies. Indeed, volunteering is the backbone of our societies.
In the face of many great challenges, volunteers around the world have given their time, energy, and skills to offer assistance to their communities. From delivering health services to providing meals or simply lending a caring ear, volunteers have played an essential role.
Whether it is our UN volunteer doctors in Yemen who are on the front lines in healthcare facilities, or a group of volunteers in Peru who have contacted hundreds of thousands of people, committed volunteers are making a difference everywhere. UN volunteers on the ground and online continue to inspire us as the everyday champions of this fight.
Volunteers offered millions of hours of service to fuel the response to COVID-19. Volunteers can make a huge difference.
Thank you, volunteers.
Thank you.
Thank you to the 1 billion volunteers worldwide for their courageous efforts at this critical time for our global family.
Thank you, volunteers, for your response to the COVID-19 crisis.
Thank you all the volunteers for your amazing response and amazing work during COVID-19.
I thank all volunteers worldwide who are acting in their communities during this pandemic.
Thank you to all you volunteers for your incredible response.
Together, we can through volunteering.
And welcome. Thank you for being here and viewing with us. Welcome again to our third live chat for International Volunteer Day. This is the last of 2 live chats that we are having today on the eve of IVD, which allows you, the audience, to learn from some of our UN volunteer heroes during the COVID-19 response. Toyin, Liza, Haifa will chat with us today about their challenges and opportunities in this time of crisis and how their assignments are going. So sit back, relax, and let's chat. So Toyin, introduce yourself.
Yeah, thank you, Jennifer. My name is Salawu Oluwatoyin. I'm from Nigeria. I'm a United Nations volunteer in World Health Organization, Ethiopia. I serve as the country emergency preparedness and international health regulation officer in Ethiopia.
Welcome, Toyin, to the chat. And Liza, from a different part of the world, introduce yourself.
Thank you, Jennifer. I'm very happy to be here. My name is Liza Noriega. I am from Guatemala, and I am a national UN volunteer at UNDP Guatemala, working with a beautiful team on the Transitional Justice Program. So as many of you may know, Guatemala suffered an internal armed conflict for 36 years. That to this day still has a lot of impacts and consequences on people's lives. So the program I work with accompanies and supports with national partners, victims and families of victims of the conflict on what is called transitional justice. So I specifically support the communication area of the project.
Thanks, and welcome again to the chat. And Haifa, now spinning back to a different part of the world. Haifa, let us know a bit about yourself.
Thank you, Jennifer, and welcome to everyone watching us. My name is HayfaSdiri. I'm a United Nations volunteer at the UNDP in Tunisia, and I work as a youth and innovation program analyst.
So for those of you who are viewing, it would be great if you put in the comment box, just let us know also where you're viewing from. And so we can get a flair for who is viewing from where and what kind of volunteering you're also doing would be great. And what is motivating you on the eve of International Volunteer Day to hear our heroes. So Toyin, I wanted you to explain to those viewing a bit about how you got to your current international assignment in Ethiopia.
Yeah, thank you, Jennifer. Actually, before coming to Ethiopia, I was working in Nigeria. I was in World Health Organization as a national staff. And I was working on a project in the use of innovation for the surveillance of poliomyelitis. Some of us will know that Nigeria is working towards, not just Nigeria, Africa is working towards polio eradication, and now they've been certified. So then we're working on tracking paralysis in children, suspected paralysis in children under 15. We're using technology to track it because of places where there is insecurity, places that are hard to reach, and getting there might be difficult. So that's what we're doing before the pandemic struck. And when the pandemic struck, we had to be repurposed to join the response team. I started from the international airports, and I joined the team in screening passengers, collecting data, and making sure that we track all the contacts of positive COVID cases. And when the government shut down the airports, we were repurposed to join the local government response team. And at the local government level, we're involved in contact tracing, evacuation of people, of COVID patients. Then we actually trained some volunteers to go into the community and educate people and then search house to house for suspected cases of COVID. These are what we were doing until I got infected with COVID. And I was transferred to the treatment center. I was in treatment center for 3 weeks. And during that 3 weeks, that was when I got the invitation to join the United Nations Volunteer Scheme. And being in isolation for 3 weeks, I kind of got the reflection that this is a very good opportunity for me. I saw myself as someone that could really make a change. So I didn't hesitate in taking the opportunity. And so immediately I came back from the isolation center, all the necessary things I need to do, I had to do it. Then I had to leave my job, and then I came to Ethiopia. Although prior to my joining the United Nations Volunteer, I've been involved in volunteering. There's an NGO I worked with at the national level. They are involved in the control of hepatitis B because the rate of hepatitis B infection is very high in Nigeria. So we go, we test, we vaccinate those that are negative, then those that are positive, we link them to treatment. And so in collaboration with this, because these places are hard to reach area where most of the people, they live on farming. So we do that in conjunction with vaccination of animals against PPR. PPR is a disease that kills a lot of ruminants. So we do that. And so coming out of everything and looking at everything I knew as a survivor, I need to throw myself in to be able to help others to survive this pandemic.
Wow, Toyin, that shows real, not only resilience from your part, you getting actually contracting the virus and having to deal with isolation for 3 weeks, but also real flexibility. So even in Nigeria, your national assignment, you were immediately, as you said, you moved around so that you could provide for the immediate response to the pandemic. That's quite a story. And yes, so thank you for answering my question about how you got to Ethiopia. Liza, you started your assignment during the pandemic. Explain a bit how you perceive being a volunteer, a UN volunteer during the pandemic, maybe what you had been doing right before that, and what other types of volunteering either you yourself or others around you have experienced during this time.
Yes, thank you, Jennifer. Well, to start, I want to say that for me, having the opportunity to volunteer is something I really value and I really find joy in, especially when you volunteer in projects that you believe in. So for me, being a volunteer at UN in the Transitional Justice Program has been very significant experience. So yes, at the beginning of the year, I still wasn't a UN volunteer. However, the pandemic had already started, and I did got involved in a volunteer project that aimed to secure and distribute food supplies to marginalized communities, especially in informal settlements of Guatemala City. That project combined online and on-the-field volunteer. So I got involved in the online volunteer. That was the first time for me doing online volunteer, and I have to say it was quite a challenge, especially when you, as for like me, I was used to going to communities and talking to people and listening to their stories. So the virtuality has been a challenge. In that was a challenge in that project, but also helped me to see that if you have as a project your goal clear, there are a lot of things you can do online. So around with that project going on around May, a friend sent me the invitation to apply for the UN volunteer. So I did, and since June this year, I am at UNDP Guatemala, and also until now also has been an online volunteer. To this day, I haven't met my teammates, and also I don't want to say that hasn't been a challenge. However, I do think that virtuality also has been this year a very nice opportunity to bring people together. And I have seen it in the project we work, because our national partners, people working there, have had the opportunity of adapting their work to still get the goals they want in the virtuality. So that is how I got to be a
That's how you are where you are today. Thanks so much. So you started as an online volunteer, also volunteering in the community, which so many people around the world actually are doing at this time. If you viewers have any experience yourself about online volunteering or volunteering in your community, we'd like to hear about it. So go ahead and put that in the chat. And also have in mind that after a few questions that I'll be asking to our heroes here, then we will have an opportunity to actually ask some of the questions that you have. So if you can start thinking about those and also putting them in the chat as well, that would be great. But just, Liza, just to clarify, so now you actually are part of a UN volunteer assignment, and due to the pandemic, you're working from home, but this is a regular assignment, right? So looking into the future, we will see that we hope that you will meet your colleagues soon in real life, flesh and blood. But it's nice to see that virtually it works as well. Haifa, you are also with UNDP, and you have, I feel, a very unique and really interesting assignment. Describe it a bit, and also the situation and how your assignment in innovation and in the lab has actually changed during this time, and what opportunities and challenges you see have come out of the pandemic for you in volunteering.
Thank you so much, Jennifer. So maybe to put it a little bit in context for our viewers to understand a little bit of my background, I started with a program that I'm working with right now as a UNV as a beneficiary back in 2016. And then I volunteered for approximately 1 year before my UNV assignment, until I got my UNV assignment in 2018. So when I first started, I spent 1 year, kind of perfecting the job, understanding how things work, so that I thought in the future it would be something close to a smooth sailing. And then COVID happened. And for me, well, COVID was a real challenge, because what I was used to be doing for back then 2 years, out of a sudden became no longer valid. I could not reach the same beneficiaries in the ways that I used to do before. I could not involve young people in the same way I used to do before, and everything has to be revamped and reimagined and reconsidered. So that was a real challenge. But at the same time, all the plans that we had, maybe in digitalization and infusing innovation in the work that we do on a country level basis, what was at a point not necessarily a priority, all of a sudden became crucial, mandatory, and urgent for everyone. The paradigms of work changed. Everyone was working from home. And this is completely new for Tunisia. We weren't used to do that. Usually that's, for us, a very inefficient way to do work. But now everyone, was forced to do it and to learn how to do it. At the same time, the digitalization process got extremely accelerated, and we had to step up to that and to offer our services and what we had to offer to make sure that, the institutions and the government are up to date with that. So it was really an opportunity, and the vision that I had for the country, all of a sudden started getting realized. But at the same time, it was not only applying things that we knew, but rethinking things for the future, right, on the same spot. So you had to rethink, how can you make sure that this transition from, physical face-to-face community reaching events to these online things and still be inclusive for everyone, still make sure that you're reaching up everyone and you're not excluding everyone. So honestly, for me, COVID was an opportunity for change, an opportunity to rethink the world, and a challenge in itself that's very, very useful so far.
So true. I mean, thank you for that. I think all of us have experienced the huge acceleration in digitalization during this time, and that is a crossover that will just continue with us. This is, no going back, and that's something that we can be grateful for. We can also be very conscious of there are inequalities that occur also with digitalization. So, that not everyone has access to online. And I think that the United Nations is particularly also aware of that. And that is really, I think, an interesting point. So let me go back to Toyin. And Toyin, what are you doing now that you're in Ethiopia in your international assignment? During your isolation during your COVID isolation period, you reflected and decided that you needed to serve even wider and broader, and you're now in Ethiopia. What are you actually doing now in Ethiopia in your assignment with WHO?
Yeah, thank you, Jennifer. Actually, COVID infection has escalated a lot of things. It has brought a lot of things to the limelight. One of it is preparedness, which is very, very important in disease control. And I'm a preparedness officer. And there's a legal framework that every country assigned, almost every country in the world assigned. And then the framework tends to guide country on how to build a capacity to detect and then to report and then to control and manage infection, not just the pandemic, even local infection, but we focus more on diseases that can cross border. So what I do is that I support the country to make sure that they build policies, they have guidelines, they have steps, they build their capacity to make sure that any disease, any outbreak, any infection can be detected, can be reported early, can be detected, and then can be managed and controlled before it escalates. And we do that by, first of all, it has to be from the up. So we start from the country level, build guidelines, then go to the regional level, and then to the community level. And so like now we have some priority disease in Ethiopia. And highly pathogenic avian influenza is one of it. Avian influenza and COVID, they're kind of related because they're both respiratory infection. So we kind of build policies to make sure that in case any of this disease is detected or anybody is infected, it can be detected early and the right response can be done. And so countries, even at the lower level, at the community level, as we're looking at infection crossing border from grand crossing or through the point of entry, you're also looking at the community level. In case there is an outbreak, in case someone gets infected with an unknown virus or even a known virus, we want it to be reported to the right person. And when you get to the right stakeholders, they can know what to do. So those are the things we support the country to do. But in this time of pandemic, things have really changed. And so everybody is involved in a lot of things. And so despite the fact I am a preparedness officer, I still support regions to make sure that they are responding to COVID in the right way. And now we are looking at incorporation of essential services. Most of our facilities, and hospitals, most of them have been focusing on COVID. Now we are saying, don't focus on COVID alone. People are dying from other infections. People are dying from other diseases. Make sure that you incorporate other diseases into your system. So that's one of the things. I was in Somali last month. We kind of went to Somali to look at how they're able to respond. And the point of entry in Somali is very important to the country. And so we evaluate the response and know how to support them. And, one of the issues now is risk communication, which is like a global thing, the use of face masks, the hand washing and all those things. So we're helping the country to make sure that they build policies or they do things that will make people to have the right perspective to the infection. People are getting more complacent. People are feeling this infection is no more there, but to be sure it's there. And the second wave is actually air, not just coming, it's air. So we are helping them to make sure that they build the things, they put things in place that will help everybody to protect themselves against infection, any form of infection.
Thanks, Toyin. Those were lots of mouthfuls of information. I have to say that a little caveat to say that Toyin is a expert in the field of many diseases, and so we'll come back to that, I think. But I think it shows the real relevance of having expertise, and all of you as UN volunteers, you'll see when you speak, you show a real passion for the expertise in the area that you're involved with, and it just is really impressive. So thank you for that. Liza, I want to ask you about your impression of people during the pandemic, because you also were volunteering in your community before your assignment, and now you're involved in your assignment as a UN volunteer with community outreach in many ways. What's your impression of people coming together, and what sort of spirit do you see during this time of crisis?
Thank you, Jennifer. Yes, actually something I have learned during the past years is the value of taking care of each other as a community. I think there's a value there that sometimes we don't see. And I believe that in rural communities, or that's my impression away from the big cities, taking care of each other as a community is more valuable. And the pandemic has showed us the importance of taking care of each other. So when I see or when I listen to people coming together, what I think is that people caring for each other. And people caring for each other is, it has a lot of, you can do it so many ways. I mean, as Haifa said, Toyin said, I mean, there are many things going on. And as for example, in our project, taking care of each other or people coming together for example, in the communication area is also planning communication strategies so that organizations can adapt themselves to virtuality. And I have to say, I agree with Haifa about the challenge. A lot of countries, and Guatemala is also one of them, a lot of countries still have to get virtuality to all, to the digital area that can come to all of us. So is planning communication strategies, is also researching and sharing accurate information about COVID-19, respecting cultural differences, language, and with a cultural approach. So for me, that is also coming together. And I know that as for my Guatemala volunteer colleagues, we are also, as a community and a network, are doing a lot of work, creating websites, doing communication strategies, data management for decision making. So I believe there's a lot of work doing, and that is also people coming together to face these times.
Thanks so much. Before I go to the next question to Haifa, I just want to mention that, again, if you have any questions for the panelists, then please put them in the comments chat, because we will be getting to that very shortly. So Haifa, you're working on innovation and we talked a bit about digitalization, the importance of that, and also the opportunities. Is there local, in your environment where you're working, have you seen local people during the pandemic that you might be supporting in your UNDP projects, or even just, in your own community, or what you see around you, that have innovated to this crisis and the situation and brought positive things to society?
Yeah, thank you, Jennifer. That's a very pertinent question. Actually, what I've noticed during the pandemic, and I was aware of before, it just the pandemic really amplified it, is the fact that innovations happen most often than not very organically, because they're a way for people to survive. Innovations, are not a beautiful addition that we add to an equation that's already made just to make sure that, we look funky or cool. Innovations are, different ways that humans came up with to survive in history and to get over very complicated events and milestones in human history. And so obviously in COVID, being a huge challenge on a global level, Tunisians as well had to step in and, to find new local innovations that could make them as a community, as Liza said, collectively get over the challenge. It happened quite organically. So you had people, you had youth from all over the universities in Tunisia coming together. You had people from the diaspora that left the country, and that was pretty inspiring because, at a point when you think about the brain drain, you're like, okay, these are people who left the country. But then it's incredible that the tie is still there, that, the first thing that when something like this happens, the first thing would be for them to help Tunisia and to help their country. And at the same time, you had different actors in the civil society. You had researchers, you had people in academia, and you had people on the ground, normal citizens who thought that that was, the moment for them to be the heroes of their own life. And they all came together, whether, face to face, or at the time it was mainly Facebook groups, like 10K worth of people all over Facebook brainstorming new innovations to survive the COVID challenge, mainly in the first lockdown, in the first wave that happened in March and April. And then, well, obviously, given this situation, the best way for the UN to move forward was to offer all of its support to these already made local innovations at a community level. That's where our input was mainly put. We organized a series of social innovation camps with youth. The main thematic was, what are your innovations for the COVID crisis? How do you see the world after the COVID crisis, whether for the response currently or eventually for the economic and social recovery? And then once they pitched their ideas and we collected all that, we would support them in achieving them and implementing it.
Fantastic. So that's crowdsourcing at its best, from organically, from the ground up. And that also segues nicely into the next question, which is less of a question, a bit of an exercise for you, you UN volunteers who we have here. We are now, so to say, seeing a bit of a light at the end of the tunnel. We see vaccines that are being approved. We see recovery in many places beginning. I would like to ask you three, who are UN volunteers on the ground that are dealing with this every day, what do you see what do you envision for the future? And let's say, give us a point in time in July 2021. And what do you envision for your community that you're volunteering in, for you as a volunteer, and for volunteers in general? So Haifa, you go first, then Liza, and then Toyin. And yeah, just bounce some creative energy off each other and give us a vision in 6 months to come.
That's fun and pretty energizing, actually, in the situation we're at right now. It's lovely to start seeing the light at the end of the tunnel. For me, it would be given that I'm assuming that at an international level, a lot of innovations would happen, would be starting to live in this new normal that we're getting too used to. I would say that in July 2021, I would be mostly working on making sure that the innovations that are happening at a global level are contextualized and localized enough for every Tunisian citizen to get used up.
Very forward thinking.
Well, for me, I also think innovation is something I will look forward to in Guatemala. And I believe that, as I said before, I think we are a global community. So I hope for that also, that we take care of each other as a global community, but also locally, that organizations, and specifically in the project I am collaborating with, I know they will continue their work, the community work they have been doing for years, with in the rural areas and especially with indigenous populations. But I hope and I believe that this year has brought them also tools and accurate information to adapt their work when something like a pandemic comes on. So I hope that locally communities have more tools and information to work with.
Yeah, for my home part, one of the things I believe that should be available by July 2021 is the vaccine, which we're hoping to be available because the global community is actually looking forward to that. And we're sure that by 2021, we should have a vaccine that can actually reach everybody. I know, as in with the experience in polio, it's not just the production of vaccine alone, but even getting it to people in the remotest area. And those are where the volunteers will come in, because you can't get vaccine to people. There's so many places, there's so many insecure area, there's so many inaccessible area. So that's why we need even more volunteers to be able to take those vaccines to them, to make sure that everybody have an access, everybody have a chance to survive. And they really said about innovation, because now that's all we need. We even at the community level, things have changed. People don't just walk into facilities to tell them, I'm having a headache. No, some people will rather stay at home because they don't want to get infected. So we're looking forward to a world where people can access healthcare in a, let's say, modernized way. People can have access to doctors, to nurses. They don't have to go they don't have to go to health facilities before they can access healthcare. I know the COVID-19 has been about virus, spilling of virus from animals to human. And so we are looking forward to a world where even if there is a spilling, it can actually be contained at a local level. We're not looking for another pandemic. You're looking actually, because even that's why the fact COVID is on ground, there's so many viruses that's already been detected. But because it has not yet become a global thing, that's why it's not yet known. So we are trying to make sure that at every level, in every community, where people have interaction with as animals, where people have interaction with the environment, virus infection can be contained in different areas. Like in Ethiopia now, we are working on strengthening of One Health. One Health is like a framework in which that people know that your health is connected to your animals, your health is connected to the animals around you, your health is connected to your environment. So we're trying to create more awareness to make sure you know that everything you do has a consequence. When you have interaction with wild animals, it has a consequence. So when people are aware of that, they'll be able to know the kind of measure they need to take. So we are looking at a world where less mortality and less morbidity from diseases.
Thank you. Thank you, all three of you. I have greater hope listening to you about the future, and I hope that those that are watching also do. If you have something to share about the vision, especially about volunteering in the future, in the new year, then please join in the chat as well. And I just want to take this moment to acknowledge the three of you, Haifa, Liza, and Toyin, for being amazing representatives and chosen here to speak to everybody on the eve of International Volunteer Day, because you really show not only, in a way, heroism during the pandemic, but a true spirit of volunteering. And this is really to be commended, and especially with those last comments, I mean, giving us a vision where people like yourselves as experts are leading the way to show that there is a brighter future, that there's something that we can look forward to, that we can contain future diseases, that we stick together as communities, and doing this all in a digital and innovative way. So thank you very much, but we're not done yet. I just wanted to recognize you. And I wanted to ask you one last question before we go to some other questions from the field. So just really quick, what does International Volunteer Day mean to you? In like 2 words. So Liza, if, you know, just spontaneously.
For me, it's confirmed that we are a global network of people around the world doing great things.
Toyin?
Yeah, it means everybody, anywhere you are, any level you are, you contributing the little you can to make the world safer.
Nice. And Haifa?
For me, it means paying things forward. The more you get, the more you give.
Okay, so on that note, let's see what else we have here for some questions. And we'll just keep Haifa on the hot seat. What was your top lesson learned during the pandemic, COVID-19?
So my one lesson learned, I would say, is the importance of me taking care of myself. I went through a burnout during the pandemic, and it was the first time experiencing something like that or anything related to mental health issues. So that's when I realized how important it is for me to take care of myself to be able to take care of others.
Thank you so much for sharing that. We actually had a chat last week with the Scouts where Toyin was also a part of that, specifically about mental health. And it's so important also to share those things with others. And so thank you for that. And it is so essential. So you are so right. Liza, what would your advice for our audience who are asking how to become a volunteer, and how might they get involved in volunteering in their communities? What might be the first step for somebody?
Well, I believe that for me, the pandemic showed me that communities are still working and communities didn't stop moving and working, and help is everywhere, everywhere is needed. So I believe that there are a lot of chances. Sometimes you just need to approach and ask. So my advice would be to do a little research and to not be afraid of asking if you can volunteer and help.
Great. And Toyin, here's a tricky one. Somebody's mentioned that in some rural areas in Africa, there might be a denial or a thinking of non-existence of COVID-19. What would be your first reaction to that, and how would you help people to understand that this is real?
Yeah, I think not just in some places, there's so many places that people are denying the existence of COVID. But anywhere that kind of thing is happening, you need to do a risk assessment. We need to know why they think COVID is not existing. Why they think, there's some places where some people are showing clinical signs. They went for the test, but it came out negative. But so many things can be attributed to that. But we need to know why this thing is happening. We need to know why people have this kind of perspective, why they think COVID is not real. So after that, we then know what kind of risk communication strategies we can use. Because over time, things are changing. Things have changed. COVID has actually changed our life. So we should know that.
Oh, she's muted.
We should know that no matter what we do, we need to make sure that we need to put in innovation. I mean, not just the risk communication we use for Ebola or we use for one other disease, we can use it for COVID. We need to re-strategize and know how to really pass this information to people in the right way.
So true. Thank you for that. It just reminds me also that the UN as a whole we're now part of the Verified campaign coming from the Secretary General's office, and this is so important about getting verified information. This is what the Verified campaign is actually all about, and that WHO is always an excellent resource, of course, as well, to get factual information and keep yourself and your communities informed. So before we close, I would like to ask all of you to think about one of the calls to actions that we have is give a heart, and to let the viewers know who or which group of volunteers you will be giving a heart to on the eve of International Volunteer Day, and to express a little bit about why that is. So, Liza, who are you giving a heart to?
Thank you, Jennifer. I want to give a heart to people I met during this pandemic and during this assignment. And those are the national partners of the Transitional Justice Program, because although this year represented many challenges for them and their community work they have been doing for years, they adapt themselves, they learn new ways of approaching and continue working on what they believe, that is assuring truth, justice, and repair for everyone. So I pass my heart to them.
Wonderful. Toyin, who's your heart for?
Yeah, I'm giving to, there was a set of volunteers that I trained in Nigeria. Yeah, we've been using them. They're like community informants at the, let's say at the community level. They were involved in polio eradication, and then we actually proposed them to join the COVID response. And as I said earlier, some of them, I don't know if I mentioned, some of them actually got infected, and it was kind of challenging for us. So most of them actually dedicated their time, despite the fact it was a volunteering job. It's not, volunteering, not just volunteering at a high place, but even at the local level. That it may seem unrecognized. So I'm giving my heart to community informants in Alimosho LG.
Thank you, Toyin. And Haifa, who's your heart for? Give a heart.
So my heart goes to all the youth who have facilitated the social innovation camps that we had since April. And they're all the SDG campers. Without them, this would not have been possible. So to all of the SDG campers, I give my heart.
Thank you very much. And in closing, I give my heart to all three of you. Thank you very much for everything you do. And the 3 UN volunteers also this morning, who are all representing, all of you are representing the over 9,000 UN volunteers that are serving the UN at this very moment. And happy International Volunteer Day. And thank you so much for your participation. It's been really enriching. And thank you everyone also for viewing. Bye, everyone.
Bye.
Here, take it.